Welcome back. Maternity staff at Bloemfontein's Pelonomi Hospital have downed tools to protest the lack of personal protective equipment. They're accusing management of flouting COVID-19 regulations. I want to bring in our reporter Makgala Masiteng. She's following up on this story. Makgala, very good morning to you. So what's the latest on the ground? What are the workers' complaints?
Good morning, Blaine. Yes, we are at Pelonomi Hospital. We are with some of the staff from the maternity ward from this hospital, and they have boycotted work, saying that management is flouting COVID-19 regulations. Among issues that they are raising include a shortage of PPEs, and some even say when they raise some of these issues, they are being intimidated. But we have some of the workers here who will tell us more of the issues that they are facing that has led them to taking this action today. Thank you very much for joining us. Just tell us, what are some of the issues that you are facing at the maternity ward?
I work at gynae clinic. Sometimes a day we received more than 67 to 70 patients. There's no social distancing. 3 of our staffs, they've tested positive. No one has ever said, any management has ever came to us and asked us whether we test or initiate anything. The only thing that I remember they did in gynae clinic was cleaning after 4 while we were there, taking patient to where they're supposed to be, because in gynae clinic we take patient to antenatal, labor ward and gynae ward. So even if they have cut the number of patients, because we were not seeing gynae because of this COVID and there's no social distancing between the patient, they had to cut gynae. But still, I'm telling you, the things that we see there, you can even go and check for yourself. I've worn a PPE for 5 days. I've worn PPE for 5 days. I was told to wash it if it's dirty. We don't receive masks. Masks, they come with 1 box, 5 box. For how many people? This has gone way too far.
Thank you very much, Mayor, for that issues. We also have another worker who will tell us more about some of the issues that you are facing. Tell us more about what you are facing as workers at the maternity ward.
The issue that you are facing right now at the moment is that we've been asking the management to actually help us with the fumigation, because a whole lot of staff members, about plus minus 90% of the staff members were positive. And then we asked them to at least fumigate the place, and we'll come back to work. Because you must remember, the COVID is not only on the surfaces, it's also on the curtains. So if they talk about the deep cleaning, how effective is the deep cleaning? That is the question that we've been asking, and we didn't get the answers. The other thing is, in labor ward, we don't have isolation specifically for patients who are positive. So you have to nurse the COVID positive patient in one of the delivery rooms. After you are done there, you go back to the normal patients and go on with your work as normal. So the only thing that we are stressing on is the fumigation and designated place for COVID-19 patient and the suspects. That's all we're asking. Thank you.
Thank you very much, Blaine. Those are some of the issues that workers are raising: shortage of PPEs, and also saying that COVID-19 patients are in one place with those who don't have COVID-19. There is no isolation of this patient. But we also want to take another side where workers are saying they have been intimidated when they raise some of these issues. We have a worker here who will tell us more about what has been happening when they raise some of these issues. Thank you very much for joining us today. We want you to take us more into what has been happening when you raise some of these issues, the shortage of PPEs and the issues of patients being in one location, whether you have COVID-19 or not.
Good morning, and thank you for being here. Yesterday we had a meeting with the management. When we raised, it was a feedback meeting where they told us they won't fumigate the hospital, it's not in the policy. And then when we talked about, we know that it's not, the COVID doesn't only come with with surfaces, with PPEs and other stuff. They told us that we are making parties in our kitchen room. Moreover, we are short-staffed. We work hard for the whole day. We don't even go to that kitchen. We go home and eat at home. We don't have parties that we are holding. And they promised to look. We were with our union reps in there. They told them that they're gonna make sure that they search for these accusations that are talking about, and they will charge us for that.
You talked about something earlier, that when you are raising these issues or when some of you test positive, you are being told that it is because of your fault that you are testing positive.
Yes, that's true. They say we are going out to the funerals, we are going to parties when we are home. Moreover, we are not even having that time because we work hard at Gynae Clinic and the whole unit, even the hospital as a whole. There's nobody who has time for parties and everything.
Thank you very much, Blaine. Those are some of the issues that workers are raising, and they even, as she just explained, the fact that when they raise these issues and when some of them test positive for COVID-19, they are being blamed. The management is telling them that they are getting the virus because they are being careless, whereas they don't even have enough PPEs. These are some of the issues that workers are raising. Of course, we will be speaking to the Department of Health just to get their side of the story, because this is not the first time that these workers have raised these issues. We did the story last week where they told us that these issues, they are not true, they have been addressed. So we will speak to them later on to find out what has been happening. We even spoke to the Human Rights Commission, which was brought onto this matter, and they said that they will be addressing this matter with the Department of Education, the Department of Health. So we will also get the reaction from their side as to what has been happening with these issues, because as you can see behind me, these are some of the workers from the maternity ward. Most of them are here, and the question is, what is happening currently at the maternity ward? Blaine?
That's the big question, isn't it? What's happening inside? What's the situation with regards to expecting mothers, those that have given birth as well? That's the concern. But we heard the concern from the healthcare workers. It seems to be a ubiquitous issue, isn't it? Countrywide, we definitely need the department's response with regards to this. So when you do get it, please come back to us to get you on air. We need that response from the department. Makgala Masiteng, they're live for us in Bloemfontein.